For those who've dieted and exercised but still can't get the results they want, there's a new option now available. It's called power liposuction, and it's used to target specific areas like jiggly thighs or love handles. Unlike traditional liposuction, the procedure only takes about an hour, and patients are awake the entire time. All morning long this morning, we'll be checking in with Dr. Bruce Katz, a dermatologist here in New York City, who's going to explain the procedure and actually perform it live. He's actually getting started here this morning already. If everything goes according to plan, his patient, Janine Murray, will be dressed and ready to go home before we're off the air. A little lipo with your cornflakes this morning, Mr. Gumbel.
Ooh, get the bags ready.
This morning we've been following a live power liposuction procedure as it unfolds. The new body shaping surgery has been touted as faster and safer than traditional lipo. But like any surgical procedure, there are complications to worry about, and Dr. Barney Kennett is a dermatologist to explain some of those. Doctor, good morning.
Hi, good morning, Jane.
As I was reading last night, in 1999, liposuction was the most popular form of plastic surgery, but in the past, it's also been one of the most dangerous forms, correct? I mean, why is it safer now?
True. It's the most commonly performed cosmetic procedure in the United States. For the past 12 years, there's been a growing interest in performing this procedure with local anesthetic. And that's why it's now a safer procedure than that which was performed under general anesthesia.
And what's the difference? Why is it safer with the local?
Well, there are inherent risks to all surgery. Specifically, general anesthesia has its own subset of risks, including fluctuations of blood pressure, decrease in oxygen levels, etc., etc. Local anesthesia allows you to avoid all those risks that are inherent with the general anesthetic. Of course, you still have the operative or surgical risks to consider, such as bleeding and infection, but you eliminate those that are inherent to the general anesthetic.
We're taking a look at the picture of Janine Murray and Dr. Katz performing the procedure here. We should say that while Dr. Katz is certified to do this, you no longer have to be board certified to perform this procedure, to perform liposuction. General practitioners can do it, dermatologists can do it. You really have to be careful who you go to.
Well, true. It's just like anything. You need an experienced, conservative, careful practitioner who uses good medical judgment. Let me tell you that there is no specific board certification for liposuction per se. Generally, doctors such as dermatologists or plastic surgeons are well equipped to perform liposuction carefully. Again, it comes down to experience and judgment.
So there's no certification necessary, no training needed to do this sort of thing?
You need a great deal of training, especially if you're going to use a sophisticated instrument such as a power liposuction instrument. And I would ask you to ask the physician if he's used power lipo, if he really has experience in that particular instrument.
This is a cutting instrument, as we were saying before we started here.
Correct. It facilitates snipping out bits of fat. It's a little easier to use. It requires perhaps a little bit less time. But it's just a subset of local anesthesia liposuction, which is where the real safety improvement has occurred.
Let's go over some of the things you should watch out for if you're planning to do this. Make sure that your doctor doesn't take out too much fat as he's performing liposuction.
You may want to have a lot of body areas done in a single day. It's inadvisable. If there's a lot to do, it's generally recommended that you separate it into several days.
Do your tummy once one day, thighs another day.
Liposuction done carefully is permanent. Once you get it out of the way, it will never come back in that area.
Okay, so what if you do gain weight?
Of course, the fat can come back. It can go to a different area, and there's a remedy for that: diet and exercise. Liposuction needs to be used in conjunction with diet and exercise. It's not for obesity, it's not for weight control, it's for shaping.
Let's be real upfront about the side effects quickly. Bruising, bumpy skin, unusual skin pigmentations, these are all problems that can develop.
Absolutely, even skin ulceration. I separate complications into two categories: medical and cosmetic. We talked about medical, and you've mentioned those cosmetic concerns.
All right. We'll check in with Janine and Dr. Katz at the end of our show. Dr. Barney Kennett, thanks very much.
Thank you.
Good to see you. 7:52. Much more to come on the early show. We're back after this. In an effort to get rid of the little belly that she's struggled with her entire life, Janine Murray has spent the last hour undergoing a power liposuction procedure. The dermatologist who performed the operation is Dr. Bruce Katz. They're both in his New York office this morning. Good morning to both of you.
Morning.
Good morning.
How'd it go, Dr. Katz?
Well, Janine was an excellent patient, and it went very smoothly. I think we'll get a great result, and it really was very quick, very easy.
How do you feel, Janine? Can you notice a difference already?
Well, I wouldn't say I noticed a difference already. I feel great, though.
You feel great? Were you a little squeamish about the prospect of looking down and watching all this happen since you were under only a local anesthetic? What was the worst part of it?
I have to be honest, there really was no worst part. Maybe in the beginning, just a few needles when the anesthesia was going in. That was it.
Yeah. Did any of this worry you? Were you nervous at all going into this? Did you have any apprehension?
For some reason, I really didn't. I wasn't nervous at all, which was very surprising to me.
So, Dr. Katz, everything went as planned, correct? What can Janine expect now? To go back to work in a couple of days?
Yes, usually we ask our patients to take off the day after the procedure and then go back to work the next day. We have had patients, in fact, who've gone out that night and had dinner. But usually it's good to take it easy for a day and then you can go back to work. You're a little sore and slightly bruised, but then you're fine.
We saw Janine, for the most part, on the table, but there in that video we saw her standing up. You finished the procedure, actually seeing how her body settled into itself?
Well, yes, that's really made a dramatic difference, Jane, for this whole new power liposuction technique. We can have people stand up at the end of the procedure and see how they're going to look while gravity is actually working, which we couldn't do before with the traditional approach. So we can get much better results, and there are very much fewer redos or touch-ups.
What if, Dr. Katz, heaven forbid, Janine gains weight after she's had this procedure? What will happen?
You know, there's a common misconception about liposuction when that question is asked. What happens if people regain weight or gain the weight back? It'll go to the same areas it would have gone to if they did not have liposuction. So liposuction does not change it. You don't develop a broad neck or a hunchback or broad arms. It would just go to normal areas that it would if you didn't have the procedure. So it really does not affect how you regain it.
So your middle area is not reconfigured at all? It's not bumpy or lumpy if you happen to put on a few lbs after you've had the surgery?
No. The great thing about liposuction is that because everyone is only born with a certain number of fat cells, you cannot regenerate them. So they're gone for good, and the result is permanent.
Janine, are you considering power liposuction in other areas? You had it on your belly today.
Possibly my hips or my love handles. I think that would complete it because everything else I could lose on my own.
I know you didn't tell your mom you were having this done today. She knows now. What would you tell her about the process, about what happened to you this morning?
Well, first of all, my father kept her away. I think now that it's over, we could tell her, and I think she will be thrilled. As long as she knows I'm okay, which I am.
All right. Janine Murray, Dr. Bruce Katz, I know you got a long day of power liposuction patients ahead, Dr. Katz. Thanks for letting us in, and Janine, you too. All the best.
My pleasure.
Mine as well.
Enjoyed it.
Thanks again.
I love that we only have X amount of fat cells. That's the big headline.
Some more than others.